What are ACEs and ARBs? In this Your Heart in 90 Seconds, I will explain what ACEs and ARBs are, how they work, and what they are most commonly prescribed for. Don't forget to subscribe, and remember to click on that bell so that you get notified when we release a new video. So ACEs and ARBs are basically two different classes of medications that do the same thing. There's a chemical pathway that happens throughout our bodies that cause little blood vessels all over our body called arterioles to constrict. Both ACEs and ARBs act on that pathway and block either an enzyme or a step in that pathway, and so help our blood vessels relax. So relaxed blood vessels are bigger and can lower our blood pressure. That's basically what they do. Now ACEs, another name is ACE inhibitors or angiotensin converting enzyme inhibitors, long words, and they all end in pril. Ramipril, captopril, lisinopril, enalapril, and there's a whole bunch more. ARBs, angiotensin receptor blockers, all end in sartan. Candesartan, telmisartan, losartan, valsartan, and they all have another name as well, both prils and sartans, so don't get too confused. Now, these medications can have some side effects, like every medication could. One is that you could feel a little bit dizzy because they vasodilate and our blood pressure can drop. So dizziness, lightheadedness, some people feel a bit tired. Another thing that can happen because they work on our kidneys, you have to get your blood checked because our potassium levels in our blood can go up. So that's up to your doctor to follow up. One other side effect, especially with ACE inhibitors, so pril, the pril medications, you can get a little dry, nagging cough. And so if you do get that, they often will just change you to an ARB, and then you don't have that issue with the cough. One more serious complication is something called angioedema, where you can get localized swelling, and often it can be in your mouth, your tongue, or your lips. So that's a serious complication, and obviously if things are swelling around your airway, that's not good, and that would you would need to change that medication. So the indications for this, obviously it dilates or opens our blood vessels, so it is used for high blood pressure, so it is used in hypertension. It's also used to help people recover from heart attacks. So if somebody has a heart attack, it's part of their heart muscles damaged, and we want it to recover. So just like any muscle, we need to take sort of the strain off of that muscle, and one way to do that is to relax the blood vessels that your heart's pumping into, and your heart doesn't have to work as hard, and hopefully it recovers nicely from that heart damage from the heart attack. Heart failure, similar. Heart failure is just a weak heart, and it can be from heart attacks, it can be from other things as well, but the same idea, take the strain off of the heart, hopefully it helps recover and get stronger. It can also be used to protect our kidneys, so people just with kidney disease, or people who are diabetic and have kidney disease. So it just helps those little blood vessels in our kidneys, and hopefully helps them protect our kidneys. Now, as I say with every medication talk, very important, don't just stop, start, or change medications based on what I say. You absolutely need to talk to your doctor or your pharmacist. They know you best. And if you have any concerns about your medication, please see them. And I hope you found this information helpful, and we will talk again another time. Thank you.